This video is for my students and also for anyone who wants to learn essential COVID information in 2024 that's updated. I'm making this because we all need information. US public health institutions and government have really failed us on providing enough support for all of us to be okay in the last few years. They haven't done a good job communicating clear and updated information and science-based practical recommendations. And so I want to do that today. Um, along with social pressure and everything seeming kind of normal and, people calling the pandemic over, makes it really easy to tune out or dissociate, even if we've been really painfully affected, which, at this point, 4 years in, most of us have. Either we've, lost someone or lost quality of life from it. But that doesn't mean that we should ignore it. We have tools, we have information, and so I want to share that today. So who am I? I am not a medical doctor, but I am a PhD with expertise in genetics and evolution and data science. And I teach college biology and do research. So for my students, hello, I'll meet you in class. And please note that the class policy, health-wise, the public health policy for class is to stay home when you are sick. We should all be doing this. You will not be penalized for missing class for being sick. Check out the class attendance policy. You don't need to let us know every time you're sick. You have some time you can miss. So check that policy out. Everyone is encouraged but not required to mask in class, and you can ask me for a mask anytime. So this video is not actually getting into the science, but more sort of a comprehensive summary of what I think is really necessary to know at this point. I want to make it clear that this is not fear-mongering, it's just facts about what we know about COVID at this point. I want y'all to feel empowered by information and, make risk-benefit analyses for yourself to protect yourselves and others. So the slides will be available as well as sort of the links to those. So first, I just want to start us with some reflection questions, and you can kind of pause it here and think about these. But I just want us to think about how our public health habits have been shaped and how they've changed or not changed in the last several years. What factors have sort of contributed to us taking on different behaviors or not, right? There's a lot of factors, there's a lot of barriers to taking precautions because, we should be given masks and we should be given tests and we're not. That's part of public health that's been abandoned. And so we're under-resourced in that way and we're under-informed. And so that affects the choices that we can make. And I want y'all to also think about how sort of work pressure and social pressure has influenced your choices. I also want everyone to think about kind of how we evaluate the value of life. These are getting into some bigger questions, but how do we decide whose life is worth protecting and preserving? Do you think of yourself as invincible? Do you think of yourself as, having the potential to get sick or something bad happen? Or not, which is especially super easy when you're young if you've been lucky enough to not face health issues yet. And sort of a last really large question, which I don't expect anybody to sort of work out now, is just thinking about how we've sort of collectively and individually processed the last several years and all the loss that we've faced both individually and collectively. So I'm not going to get into that today, but it's a lot to hold, and I just want to make room for that. Okay, so let's get into talking about COVID. So we're still very much in a pandemic. It never went away. Practices around COVID have been really, made unnecessarily political when they simply can be sort of practical and public health based. So, it doesn't need to be a part of the culture wars. It's just a virus worth knowing about and knowing how to be safe about. Politicians and institutions and companies that tell us, that COVID is over or we shouldn't be worried. They're doing that to keep us working and to keep us buying. And this is at the expense of lives, lives and quality of life. We do not owe them that. Life is worth protecting and y'all's life is worth protecting. So the first thing that's important to know about COVID is that it's airborne like smoke. So if you imagine somebody smoking in a closed room, that would be like somebody, with COVID, perhaps coughing in a room. It is a biosafety level 3 pathogen. So the biosafety level is related to what lab protections you need to work with certain pathogens in a lab. And this is a picture of someone working in a BSL-3 lab. This is the type of protection that people typically wear when working with pathogens like this. And so you can see that, something like a mask is actually quite a step down from this level of protection. Other BSL-3 pathogens that are at the same level as COVID are bird flu and the bacteria that cause anthrax and tuberculosis. So this is not like the cold or flu at all. Those are totally different biosafety hazards levels. So COVID is airborne like smoke, and it's quite dangerous. This is why ventilation and cleaning the air is so important. It's largely a vascular disease, so we've often thought about it as being a respiratory disease because it has respiratory symptoms. But it's a vascular disease, which means that it affects all of our blood vessels and blood vessel systems. And so our lungs have a lot of blood vessels in them, and so that's part of why we get respiratory symptoms. But because it can affect blood vessels, or because it does affect blood vessels, it can affect every organ system in your body. We're currently in a really high COVID spike right now. We're at very high levels, and I'll show you some data. And then I'll talk about practical things that we can do to keep ourselves and each other safe. I really want to impress that it's still a dangerous thing. There are right now about 1 million cases in the US per day, and it's still killing people every day. It's a leading cause of death in children and adults. I'll talk about that more. It is not acceptable that many of the people that it does kill are elderly, disabled, or immunocompromised. We've heard a lot of messaging from the government and just from the public about, oh, some people will die and that's fine. That's not fine. on no level is that fine. Everybody's life is valuable. Everybody deserves to live. We do not have to accept avoidable death. There are things in our power that we can do. We don't have to sort of panic or dissociate or just sort of normalize not doing anything. So in this, we'll talk about what we can do and how COVID affects us. Without sort of governmental and social supports for protecting yourself and others, it is harder than it should be. That's not your fault, but it's still worth being smart and careful. So let's look at some data about where we are right now. So the best way to track COVID is to look at wastewater data. So kind of gross, but a really good way to track it because it's where everybody is contributing to a sample. So the CDC has a dashboard for it. This is another data dashboard called Wastewater Scan, and I'll demonstrate how to navigate that. This is showing the national average in COVID levels over several years, and I've labeled the winter and the summer spikes. So looking at the trends over time can help us kind of get an understanding of what to expect each year, and so that we can be prepared. So we can see that we typically get really big winter spikes and then smaller summer spikes, but actually we're in a very, very large summer spike right now. The spike is sort of up and down and plateauing, and it's quite a bit larger than the previous summer spikes. So, I happen to know a lot of people with COVID right now, and the data reflects that. So we can also look at the local wastewater. This is national data, but we can actually look at finer detail if you have a watershed that is collecting data. So this is for SF State students. This is what our local water looks like. This is the winter spike, and this is where we are now. So you can see that the data is pretty noisy, but it's still at pretty high levels. So I want to quickly kind of demonstrate how to navigate this wastewater scan website. You can see that actually it has information for a lot more than just COVID over here. But if I click on COVID, I can see colors indicating that a national level of high transmission is happening right now. And each of these dots is wastewater treatment plants where samples are being taken, and the colors indicate what the levels are at that place. So I can look at national detail, or I can look at local detail. So I could have typed in San Francisco, either will work. Wherever you are, you can type this in. It'll zoom in here, and then I can click on COVID. It tells me what's going on. Here's another watershed. I want to click on View Chart Details. You should note that this doesn't work well on phones, but it works well on the desktop. It's helpful to adjust the time window, so I usually do at least 6 months so we can kind of see the trends over time, because you can see that it started low and then got a lot higher. And I want to further click on See Details here. So this lets me see over time, and you can see that I can just drag this out to see, okay, this is last summer's spike, this is winter spike, this is our current spike that we're in now. So you can add different locations to it. I could add the watershed from the other side of the city here, and you can see that it's similar data, a similar data trend here. So this website is really useful. I use it to check COVID rates like the weather. So, if I'm like, ooh, I really want to go to this concert, okay, I'm going to check this first to see where we're at. Or maybe, if the concert's in April, ooh, that's a good time to perhaps go, something like that. So it helps you plan in that way. So I'm trying to impress that the COVID is very much still with us, and COVID is still very much having effects on us. So this is data showing the proportion of the U.S. population that is disabled, and so this is the start of the pandemic here. We can see that the disabled population has gone up about 13%, or about no 9%, uh, since the beginning of the pandemic. That's quite a lot, right? We can really see a pattern here. This magenta line is just the US population total. And disability is the only sort of marginalized group that you can, join immediately. It's kind of weird in that way, right? It's important to shift our thinking on disability, right? Because any of us can become disabled at any time. And if we're lucky enough to age, then all of us will likely become disabled by age at some point. So it's important to not distance ourselves and think that we're immune to this if we're seemingly sort of healthy now. Culture really encourages us to think that we're invincible, but all of us are vulnerable and could join this group at any time. So I mentioned that COVID is still a leading cause of death, and it absolutely is. So this is showing causes of death, and this is not the original COVID spike. This is data from 2022, so this includes Omicron data, the current version of COVID that we have. So we can see that in children, it's actually the sixth leading cause of death, which I find that really tragic. There's so much to say on that, actually. I won't even get into it. But you can see that as you get older, COVID becomes even more of a risk, and is the third leading cause of death for people that are over 55. So it's still very lethal, still very dangerous. People talk about it being mild now. Sometimes it is, sometimes it's not. And even mild cases can have bad effects later on. So I'll talk about that more too. And, it's worth understanding how different factors affect our health outcomes. Socioeconomic inequities really affect infection rates, they affect death rates, they affect long COVID rates, which I'll talk about in a minute, and other consequences of disease, right? Financial, relational, education. In this governmental data from about 1.5 million US cases, it showed that Indigenous and Black and Latino populations had higher hospitalization and mortality rates than white populations. This does not have to do with some inherent biological thing. Race is not really a very good biological variable, as in genetics don't separate out well into races. People within the same race can be genetically sort of more different than those in different races. So race is a socio-political concept that very much affects our lives. It very much affects our lives, and this is part of how it affects our lives. So, you can imagine, right? If you can drive a car or be driven somewhere versus taking the bus where you might be exposed to more pathogens, right? Maybe your housing situation, you live in a multi-generational house, you live with many, many relatives, so it's hard to control when somebody gets sick. Do you have access to sort of technology and do you have insurance, right? The fact that none of us sort of automatically have healthcare taken care of is a travesty because it creates health inequities exactly like this. Are you able to kind of take off work to go to the doctor? Can you do all of this, right? How are doctors going to treat you, right? We know that there is racism and sexism and classism and ableism in the healthcare industry. So we know that people are getting different, kind of qualities of care. And so, we can go through this at every single level, right? Pre-disease that kind of increases your risk. When you have it, things that increase your risk of things being worse and having worse outcomes. And then later on, right? Are you able to get treatment long-term? Did you get any sort of, subsequent diseases from it that you're not able to be treated? So, again, there's not inherent biological differences that should make Indigenous, Black, and Latino people more vulnerable to COVID. That's not what's happening here. It's the conditions that already harm and disenfranchise those groups that affects the difference in COVID rates. So considering class and race and sort of social context is important in thinking about COVID. So I want to start to talk about long COVID because this is a really important thing that we don't hear enough about. So this is kind of showing over time a trajectory of COVID. So when you first get COVID, right, you're exposed to it. We breathe it in just like smoke. Your symptoms usually come on in a couple days, and that is where you're in the acute phase of COVID. So when you first have COVID, It can be mild, it can be bad, it can kill you. There's a lot of things that can happen from that. But even in mild infections, some bad things can happen later on. So long COVID is when, after 12 weeks after you've already had COVID, you're still having some kind of symptoms. And so, like I said earlier, since it's a vascular disease, it can affect multiple organs. So it affects so many different organ systems. And we're starting to figure out the biological mechanisms to it. So I won't get into all of this, but we're starting to figure out that COVID can live inside of your body for a long time and sort of reactivate responses. That doesn't mean you can reinfect others, but it just means that you may be continuing to respond to it a long time over time. It can cause both inflammation and autoimmunity, and then sort of affect like the cells that border all of your vessels. And we're also finding out a lot more about how it affects your microbiome. It seems to cause a lot of gastrointestinal issues increasingly, and we're finding that that has to do with perhaps a disruption in the microbial communities that live in your gut and how COVID affects those. You may see this funny word when you're reading about COVID stuff, sequelae. Sequelae is just a word that means long-term effects from some acute conditions. So this is talking about pre-COVID, when you get COVID, and then 12 weeks later, how are you? What's going on? So many viruses, most viruses actually do have long-term effects. COVID effects are just much, much more severe than what we're used to seeing. It's not like a flu at all. Again, it's in a totally different biosafety level category. Long COVID happens in 10 to 30% of cases. So that's actually quite high. And that's pretty scary. So some of the most common effects are continued fatigue and weakness, kind of chronic fatigue, trouble breathing, memory loss, confusion, the kind of brain fog, they call it. Trouble thinking, that's brain damage. Clotting and stroke risk, vascular issues like blood pressure issues, heart issues. And they can also cause psychiatric issues like depression, anxiety, and psychosis. Because it's vascular, it can also cause things like erectile dysfunction. This figure is from a 2023 review that kind of goes through how in the different organ systems, how they can be affected. So you can really see that COVID can have such a broad range of effects on so many different organ systems. That's why it's a big part of why I mask, because I'm trying to avoid that. So long COVID rates are lower in vaccinated people, but even mild cases in vaccinated people can lead to long-term effects. It being initially mild doesn't seem to protect you from the long-term effects. It's really important to know that with each new infection, the risk of these symptoms and other symptoms like diabetes increases. So as you continue to get COVID more and more, as we've all, been sort of relentlessly exposed to, it increases your chance of getting some of these more severe conditions. And increasingly, we're finding out how COVID changes the immune system. So this is sort of an interesting balance here because it can both weaken our immune systems, like if you're immunocompromised, it can certainly have worse effects, but it can also overactivate our immune systems. So this can cause, kind of continued inflammation and autoimmunity sometimes. These processes make us more vulnerable to various new infections. So if you hear people saying, wow, I'm just sick all the time, wow, this cold hit really hard this time, that's probably why. All of our immune systems are affected by this. So don't freak out, right? A little freak out because it is pretty scary. It can affect every organ system, but really don't freak out because there is a lot we can do to keep ourselves and each other safe. No matter what our practices have been and what we've known about, we can still do things now. So we don't have the tools we should for public health because public health has been really abandoned as a social and governmental responsibility. That means that the burden falls on individuals. That's really hard. It shouldn't be like that. Being under-resourced, like most of us are, limits our choices, right? There's been a lot of social and economic pressure and sort of normalized, lack of COVID precaution. And this is sort of further erasing disabled people from public life, right? Just saying, okay, if you're immunocompromised, stay home. Is that really a practical solution? Or acceptance of death, right? If you're immunocompromised, just die. That's part of a long kind of history of science that we'll talk about in class called eugenics. It really is. And so that's not okay. So more caution on average means more protection for all of us and a less individualized burden of responsibility. Currently, that individualized burden is really endangering and alienating and isolating people in our communities who are most vulnerable. So we can really do some practices that are care-based and science-based to protect ourselves and others. So I'm going to talk about three affordable ways. And, these things add up. Over time, we have to form habits around it, so that takes a little bit of effort, but it's worth it. So first I want to start out with this Swiss cheese model. This is recognizing that no single thing is going to be the one thing that protects you, and that little changes add up. So this is talking about shared responsibility, which I've seen have mostly not been taken up by our government, right? We should have access to testing. We should all have clean air, and we don't. So a lot of it falls on this end, which is personal responsibilities. But these are all layers of protection, right? So staying home when you're sick, that's one. Masking, having general kind of etiquette about being sick, washing your hands, not coughing out, So it's not all or nothing. More caution on average really adds up. We layer these. You get to change your practices, however you want at any time, no matter what they've been. It doesn't have to be perfect. So let's talk about the best tool we have. The best tool we have right now is masking. So here's some data showing how long it takes for people wearing different masks to transmit COVID or not. So spend a minute looking at this, but I'll just kind of go through it. I mask every time I'm indoors or in an enclosed space or an outdoor crowded area. Again, COVID spreads like smoke, so it's like somebody smoking a cigarette that has a deadly pathogen on it. And masks are the most effective tool we have. We have a lot of evidence that they work very well, especially the higher quality masks. So this is showing in orange the higher quality masks, and N95 is really the best protection. Here's a picture of the version that I have, but a lot of them look differently. And this is a KN95 or a KF94. They look similar. They're sort of the second best level of protection. Unfortunately, surgical masks are not actually very protective. You can see that here. So surgical masks and cloth masks are better than nothing, but not very good. I will have these masks available in class so y'all can access them. You do need to make sure it fits well. So if it's got this little fold in the middle, you kind of have to unfold it with your thumb to flatten it out to fit it to your face. If it has gaps in it, that means that COVID can get through. So you may want to tie the ends of your mask or get something that you can, fix around your head. There's a lot of counterfeits out there, so it's best to buy from medical suppliers. I'm including some masks in here and in the description of this video for where I've bought some masks, and also some other mask resources, including some local community sourced resources. So it makes no sense that there's any sort of anti-mask stuff. I don't know what's going on there. It's really just sensible. There are mask bans happening in New York actually right now that it passed. This is just a public health thing. Masks are really nice. You can relax knowing you're not going to get or transmit a potentially deadly or disabling disease. You can, be mysterious, kind of fun. So masking is our best tool. What else can we do? Okay, so we can just sort of adapt. We can think of adaptations if we understand how COVID works. So again, small practical adjustments really add up. You don't have to change your whole life. You just have to do things a little different. So ventilating the air whenever possible, right? Opening windows, cleaning air if that's possible. Hanging out outside, right? If there's a crowd, avoid the crowd unless you have an N95. You might want to limit your time because the equation is sort of time times number of people times COVID rate at the moment. Eating and drinking indoors is quite risky when rates are high. So that's part of why I check the COVID weather, right, on wastewater scan, so that I can know whether it's safe to go eat indoors or not. We can try to push back against the normalization of sort of selfishness and carelessness. It's not okay to expose people to potentially deadly and disabling viruses. We don't have to accept sort of the public acceptance of this. And finally, just practice risk-benefit analyses for yourself and consider others. Some sacrifices are really worth making, and it's very possible to live a full life while being safe. I have a perfectly great time, and I can go out and do all kinds of things, and I don't worry about getting COVID that much because I have safe practices built into my life that have taken habits to build up. So the last thing I'm going to talk about is just risk communication. So it's been really normalized not to talk about COVID. We've been told it's over, but we know it's not. And so we want to be able to talk about it openly. So if I'm going to hang out with people unmasked or indoors, I usually ask if they feel sick, right? There's still a lot of asymptomatic transmission, but feeling sick is a pretty good indicator. I also ask if they've been to any large gatherings in the last couple weeks without a good mask or without kind of checking with those people. If they've recently been around anyone sick without a good mask, and if they have access to proper testing, which I'll talk about testing now. So this is a graph showing kind of the viral load, which indicates, kind of how transmissible it is at the time. And also kind of how much viral load it will take to show up on testing. So this is showing that exposure to the virus, okay, you usually get symptoms about 2 to 4 days after, but rapid tests or PCR tests won't show positive until 5 days after you've been exposed. Tests and public health resources should absolutely be free. It's a big shame that they're not. Rapid tests don't work well now because the virus has changed over time. It's evolved. And so the best bet is to test at least 2 days in a row with a rapid test if you're going to use those. PCR tests are still the most accurate, and they're often needed to get disability for long COVID, but they're really inaccessible. Again, that shouldn't be the case. It's worth searching online for sort of cheaper options and free services. I kind of found some random stuff online that worked out once when I had it. Or checking with your doctor if you're insured. There's also at-home PCR tests where you can buy a little PCR machine for $50, and each test is about $25. So that obviously is a little expensive. It adds up. But this might be very useful, especially if you do want to test regularly. So if you do have COVID, the best thing to do is isolate and rest. Please don't spread it around. If you have to be around others, please mask with an N95 and distance from others and be outside whenever you can. It's absolutely not your fault if work or school forces you into unsafe practices, but be as safe as you can, right? I've heard things about, I'm worried I'll look lazy if I don't show up. No, laziness is a lie. Being safe is important. That's really it. It's really important to rest for the next couple of weeks and do not exercise. There's already been a lot of data showing that long COVID, your risk of long COVID can increase if you exercise or are doing a lot when you're recovering from COVID. You may want to ask your doctor about Paxlovid or Lagevrio, which are antivirals for preventing sort of severe acute effects, and they may have some effects on long COVID. We're still collecting data on that. There's a lot of kind of herbal treatments that are also helpful. It's worth consulting, a professional, an herbalist about it, and consulting with your doctor to make sure you're not taking anything dangerous with any current meds or that works for you. So again, I'm not a doctor. Talk to your doctor. These are some tools we have. The People's CDC, which is a group of public health researchers who's been sort of doing what the CDC should be doing, has a great guide and other resources for what to do if you get COVID. So it's good to read it in advance because, right, when you're sick, it's a little bit hard. So how long are you contagious? So we've gotten a lot of misinformation on this. So the 5-day rule and the now 1-day rule, these are really dangerous. They're not based on the research. They're based on economics. And when we talk about economics, we don't mean, me and you getting groceries. We mean rich people making money. All right. So what does the data actually say? The data shows that you're infectious at least usually up to 10 days, sometimes up to 15 days. We're not sure. So as much as you can, isolate and mask at least in the first 10 days. So vaccines are still very much worth getting. They reduce the risk of death, severe illness and hospitalization, and long COVID, but you can still catch COVID when vaccinated. This is not a vax and relax situation. It's worth getting. You can get it with your flu vaccine. Talk to your doctor if you've had vaccine reactions in the past. That's important. And I want to point out here that vaccine hesitancy in Black, Indigenous, Latina, and other populations that have been historically and currently abused by science and our government, that hesitation makes sense. It's got roots. It's still really worth getting, especially like we talked about earlier because of the different risk factors. So new vaccines for fall 2024 are in the works. They'll probably be out in September. These cover the newest variant. So just like with the flu vaccine, we update it when the virus mutates. We can't really rely on the CDC or government to tell us when to get them, so I usually set a calendar reminder for every 6 months to just sort of Google about boosters. All right, so in summary, COVID is still very much here. It's less severe kind of acutely than it used to be for a lot of people. It still causes death for a lot of other people and disability. COVID spreads like smoke through the air. This is why ventilation and clean air is key. This is why masking is key. Long COVID happens in 10 to 30% of cases. Even mild illness and vaccine status does not prevent that. And masking is certainly the most effective and simplest preventative strategy. Symptoms usually appear 2 to 4 days after exposure, and tests don't usually show up until 5 days after exposure. Rapid tests aren't the best anymore, but if you do 2 in a row, you might catch it. PCR tests work better but are harder to access. COVID affects marginalized people at a disproportionate rate because of different socioeconomic factors, different social factors that are, built-in inequity. And accepting that some people will just suffer and die more is not okay. It's eugenics. And if you don't know what that means, we'll talk about that more in class. Keep hope though, okay? So science continues to progress. Research on some similar conditions like myalgic encephalomyelitis, chronic fatigue syndrome, seems to be similar to long COVID. And so studying them both is helping advance treatments for both. Even though public health institutions have really failed and under-resourced us, we keep each other safe. Community efforts to provide COVID resources exist. This is a QR code for a mask block, a group of people in the community who distribute free masks. This is for us right in the sunset nearby. Disabled and ill people and healthcare experts and workers and others are fighting mask bans everywhere. It's worth fighting those. That's part of why it's worth normalizing masking, because we deserve to take care of our health. And we can do our part to normalize these things and to normalize caring for each other and trusting science. Remember that it doesn't have to be perfect, right? Layers add up, Swiss cheese safety, and you can absolutely keep living your life COVID-free. Here's some of the people I love the most, and we're all feeling good, safe at the aquarium wearing masks. So thank you. I will put all the links for this in the description. If there are any questions, I'm very open to talking about this stuff. I've read a lot, and yeah, grateful for your time.